welcome. Thank you for joining us today. My name is Kaylee. I am part of the marketing team here at Fullscript, and we're very excited to have Metagenics here today, along with Dr. Deanna Minich and Dr. Melissa Blake, to discuss the relationship between the gut microbiome and the immune system, among many other things. Before we get into it though, a little housekeeping. I just want to remind everyone that this is being recorded, so all registrants, regardless of if you have to drop off early, if you couldn't make it today, all registrants will get a recording of this event. So right to their inboxes, so don't need to worry about that. And you can also find all our webinars on Fullscript's website at fullscript.com/webinars. Also, if you have any questions throughout the webinar, in your GoToWebinar dashboard, there should be a questions kind of section. You can add them in there. We have some people on the back end able to answer as we go. And if we have time at the end, we may be able to do it live Q&A as well. So add them throughout the presentation, and we will try to answer them as we go. So without keeping you guys too long, I'm going to kick off the presentation with Dr. Minich first. So thank you all for joining us, and we hope you enjoy.
Thank you everyone for joining us for this exciting webinar on broken immunity, obesity, and the gut microbiome, addressing overlooked relationships. I'm Nilima Desai, Senior Manager of Medical Marketing and Metagenics Institute. Today on the webinar, we have with us Deanna Minich, PhD. Dr. Minich is an internationally recognized health expert with more than 20 years of experience in nutrition, mind-body health, and functional medicine. Dr. Minich holds master's and doctorate degrees in nutrition and has lectured extensively throughout the world on health topics, teaching patients and healthcare professionals about nutrition. She is a fellow of the American College of Nutrition, a certified nutrition specialist, and a certified functional medicine practitioner. Currently, Dr. Minich teaches for the Institute for Functional Medicine and for the graduate program in functional medicine at the University of Western States. Her passion is bringing forth a whole self approach to nourishment and bridging the gaps between science, soul, and art in medicine. We really hope you enjoy this webinar. Dr. Minich, the stage is all yours. Thank you for joining us.
Thank you, Nalima, for that very kind introduction. So glad to be able to speak with all of you about really looking deeper at the immune system. I know it's on all of our minds currently that, especially with COVID-19 and being reflective of the pandemic, we're thinking about solutions. What can we do? Well, in order to get to what we can do, we first need to understand some of the basic mechanisms. So in this webinar, what we're going to do is cover off on a number of different objectives. First of all, I want to unfold and unpack this whole idea of the anatomy of the gastrointestinal immune system. Truly, there is this gut immune crosstalk, and I want to show anatomically how that's set up. Secondly, I'm going to go through some medications like PPIs, proton pump inhibitors, and various lifestyle choices and how they change the gut microbiome. Of course, we all know that the gut microbiome is all the rage. It's one of the features that we need to be paying attention to. There are so many scientific publications on a daily basis. We are then going to go into looking at microbiome changes in order to affect immune response. And finally, how do we hit on multiple cylinders, the immune system, obesity, through the portal of the gut microbiome? How do we nurture our gut microbiome? And there are many ways to do that. So first and foremost, if we think of the body as a web, it's a systems web, and we just happen to be talking about 3 points on that web. We're talking about the immune system, body composition, and the gut. We could be bringing in things like the bone or the skin or even the heart, the brain. It can get very complex, but let's take a portal on in. We know that the body is a diverse landscape. There are so many different specialized cells, and how these cells cooperate defines our health. So when there's concordance, when there's coherence, we're in good health. When there's discordance, when there's leakiness, when there is inflammation and combativeness, obviously this doesn't work very well, which is why I like this graphic, because it shows not even just the population of cells, but also more metaphorically the gut barrier. I do think that we need to be thinking about mucosal membranes when we think of our immune system. So, of course, within this webinar, we're focused on the gut, but I also want us to think more broadly about the respiratory tract brush border membrane as well. There are some parallels amongst these different membranes. So let's dive in for these next couple of slides. I want to just introduce the digestive tract. I always like imagining us going through the tube to see who the players are, because we've got several feet of this gastrointestinal tract, and we need to understand who's all playing within that terrain. So key players here, if we're just thinking of the gastrointestinal tract, here we have the commensal bacteria, and hopefully these are helpful friends that are along for the mutualistic ride. Of course, we could have a whole host of different bacteria here, and we know that we have more microorganisms in the gut than we do cells of our own human body. The next part of this is the mucus layer, which is a glycoprotein network secreted by the goblet cells. So the goblet cells are ensuring that there is a sufficient mucus layer to prevent the entry of pathogens. So it's very important to ensure that we have good cell populations in order to ensure the functionality of the gut lining. The epithelial cells provide a second barrier, and what they do is they help with the cytokine and the chemokine balance. And as they move on up, as if they were in an escalator, they mature. And typically when you hear about the gut turning over every 3 to 7 days, we're primarily talking about the epithelial cells, which slough off and are renewed. And then the Paneth cells are at the bottom of the crypt, and they're important because they produce antimicrobial peptides. So you can already see that when I think of the gastrointestinal tract, I often think of a shag carpet. I think of all of these finger-like projections waving and trying to increase the surface area for absorption. And that's what we're seeing here, is a cross-section into what all of the different cell types look like from the gastrointestinal perspective. So the next layer of the gastrointestinal tract that is relevant for our discussion today is looking at the immune players. Now keep in mind that we could be essentially talking about the different neurons, smooth muscle, circulatory cells, but for the interest of this webinar, we are focused on the basic anatomical GI structure, and now we get a little bit deeper into the immune cells. And the gut is an immune cell-rich environment. And in fact, I'm sure you've heard the statistic that 60 to 70% of the immune system is actually harbored in the gut lining, in that gut tissue. And so here are some of the immune players. The intraepithelial lymphocytes are T cells that can kill antigens without priming. You've got the macrophages, and the way I think of macrophages is that they're the garbage collectors. They go around and digest debris and microbes. They engage with them through phagocytosis, and they are digesting the pathogens. And so we need macrophages within the gut area, within the gut terrain there. The dendritic cells, as you can tell by their structure, they've got those arms, those tentacles. They're playing a key role in recognizing and eliminating pathogens. And they're the ones that present antigens to the T cells. We have the T cells and the B cells. T cells are produced in the thymus, and then the B cells are these other immune cells which originate from progenitor cells in the bone marrow. Don't forget about the bone in all of this. We really do need to be thinking broader about the crosstalk. And then, of course, natural killer cells, which are important. They're in the lamina propria of the intestine. They're involved in the innate as well as adaptive immunity. So this is just a very small window into some of the players. Of course, there's complexity, there are layers, there are dynamic interactions, and much will be determined by the composition of the gut microbiome. So how do we establish our gut microbiome? How do we get a good running start into healthy immunity? Well, we need to look very early in life at our birth itself. We know that babies born vaginally get microbes from their mothers, and this could help the start of new life for that first 6 months where we have increased diversity. And so vaginal birth is very important for setting that stage. And further, as we engage with breast milk, helping with getting those immunoglobulins that help to communicate with the cells that are being established in the gut microbiome terrain in that area. So we do need to be thinking about breast milk. It's the baby's first line of immunity. These nutrients that the baby receives feed the developing immune system, while the immunoglobulins that I discussed pass from the mother to help prevent infections. And especially it's that 24 to 48 hour window after birth where a lot of these cofactors are distributed and transmitted to the infant. Now, we do know about human milk oligosaccharides. These are the HMOs. I'm going to talk a little bit more about them in the presentation. They help to do a number of things, which I'll get into, primarily helping to feed a certain class of bacterium. And they also serve as decoy receptors for pathogens. So in other words, they act to bind these pathogens. They kind of code for a binding site. And in so doing, they prevent the entry and uptake by the enterocyte. So these bacteria, if we do have this scenario at birth, it's setting the stage for lifelong healthy immunity. And as the microbes are established in the gut, they start to take care of the surrounding community of cells. So if we take care of our gut, it takes care of us. And so here's where we think about continuing to nurture and establish healthy immunity through the gut. And we know that in the gut tissue, because we have the recruitment of immune cells, that it's going to be the first line of defense. Any kind of immune reaction, engaging cytokines, helping to keep all of that in balance and keeping the barrier of high integrity so we don't have any leakiness. And I do think that these days we have a lot of leakiness. We hear about this over and over again, intestinal hyperpermeability. So what we're doing early in life, if we have that opportunity, is setting the stage for lifelong, strong immune status. So along our path of life, what ends up happening is things change. We start living fast lives. We start taking antibiotics, sometimes initiated very early on, and this acts to disturb the balance. That's called dysbiosis. So essentially there are more unhealthy microorganisms than healthy ones. And so this relationship between the gut and the immune system starts to shift. And so that beneficial barrier that we once had is now becoming lost, and we're going to be more susceptible to immune dysregulation. Now we start to talk about body composition changes. We start thinking about obesity. Because what is overweight and obesity? Truly, it's not always that we look to the absolute body weight. We need to look at the composition of that adipose tissue. And what we now know is that adipose tissue produces something on the order of 30 different adipokines. So it can be inflamed. We do know, also based from studies, that early life antibiotic use is associated with childhood obesity. So it may not even be the things that we're eating, but it's how our gut microbiome is changing through these environmental factors, through different medications, through lifestyle, maybe through hygiene practices. We think of now with COVID-19, the use of disinfectants. Are we actually changing the diversity of our microbiome in using these products, which we know are essential, but we need to know what the repercussions will be long term. So let's talk about some of the medications. I already mentioned the use of antibiotics, which are very prevalent in society. Let's talk about another one that causes a ripple effect of disruption, and that is of taking a proton pump inhibitor. In fact, it's one of the major drug classes that's taken nationally, on a national level. So these proton pump inhibitors cause a disruption in the microbiome. Why? Because they're stopping the loss of acid, and we start to see that there's a shift that leads to the infiltration of other microbiome type of organisms. We start to change that shift into more dysbiosis, having more streptococcus as an example. And we might see that coming in through mouth, nose, and skin. And then we start to be primed for more infections. So I do think we need to be thinking about PPIs as one way, one portal into these changes that can occur in the gut, can lead to microbiome disruption. And not only that, the use of medications, just in general, just even aside from PPIs definitely included, but we need to be thinking about drug-nutrient interactions. And in many cases, we can see a deficiency or an insufficiency as a result of using certain medications. And with PPIs, the ones we need to be thinking about are vitamins B12, vitamin C, and iron. And how does this connect to obesity? Well, over time, if we are depleted in vitamin B12 and iron, this can lead to anemia. This can lead to less energy because obviously with iron deficiency anemia, there's fatigue. And so what happens? Then that can be less activity, physical activity, and people might start to engage in having more energy-rich foods and beverages, thinking that those products will give them energy, when really and truly it may only lead to more weight gain. One of the things that happens is that our diet is very contributory. My background, my professional background, as you know, is that within nutritional research, and this is what I have most passion for. One of the ways that we cultivate and on the other side also destroy the gut microbiome is through the foods that we're constantly taking in. I mean, just think about it. We are in the process of digestion for 24 to 48 hours after we eat something. So even when we're not physically eating through our mouth, we continue that process through the gut. And if we are eating a diet that is low in fiber and it's high in certain fats, this is kind of a fiery blend here, what we start to get is more leaky gut. We get lower short-chain fatty acid production. And why do we care about short-chain fatty acids? Because those fatty acids are essential substrates for so many different things. They help with reducing the inflammatory response, they help to bolster immunity, and they feed a good, healthy gut. The other thing to consider is also lower secondary bile acid clearance. And so being that we don't have fiber, this distorts even the resorption of bile acids. We need bile for the elimination of toxins and also to emulsify fat. So we continue to set the stage here for dysfunction in the way of body composition, the crosstalk with liver, bone, and adipose tissue. Now, I've already been talking about leaky gut and increased intestinal permeability. There are a variety of ways to test for that. Many times you can just do it symptomatically. Often there is the need to do more firm testing, looking at the lactulose mannitol test. That can be done. But what we need to be focused on here is the inflammatory response. Inflammation leads to a degradation of the gut barrier integrity. So essentially when you have inflammation, because there's low fiber and lots of saturated fat, we have this imbalance. What can happen is we start to get endotoxin release from microorganisms in the gut. This then leads to systemic effects, and we get overall what's called metabolic endotoxemia. And this, of course, leads to changes in body composition and increases in inflamed fat. So that's why we really do need to be thinking about the diet and what it's doing to the gut. And we now know it's not just leaky gut, it's leaky brain, it's leakiness throughout the body that is being impacted by inflammation. Let's talk a little bit about circadian rhythm. It's not just what we are eating, but it's how we are eating and when we are eating. There are so many different questions to be evaluating, and circadian rhythm is a really hot topic right now. The idea of chrononutrition and how circadian rhythm disruption, if you look in the literature, there's actually a new term or just a generic terminology to refer to the metabolic issues that ensue from circadian rhythm imbalance. And so it's been defined as the circadian syndrome. So I know that we've heard of metabolic syndrome before, we've heard of cardiometabolic syndrome, and now there's circadian syndrome. What does that mean? All of these things right here. Glucose dysmetabolism. We now have an imbalance in the immune and inflammatory cytokines and chemokines. And the gut microbiome suffers through all of this, right? And so if we start to degrade the gut microbiome by having this dysmetabolism and heightened inflammation, then overall our mood, our sleep patterns, how we eat, how we metabolize, things will start to shift. So I do think that this area of medicine is getting much more attention, and I'm really glad that it's happening. There are sufficient studies to suggest, and we've known about this for some time, looking at metabolic effects of not adhering to the proper diurnal rhythm. And so we're starting to see some greater crosstalk with the gut microbiome. Speaking of which, let's talk a little bit about sleep, because sleep we've been hearing a lot about as it relates to the pandemic, people needing to make sure that they have adequate sleep. And I would think that some people are getting even more sleep than they normally get, but other people, because of stress, because of poor eating habits, because of gut inflammation, they're actually having sleep disruption. We know that insomnia is associated with infections and inflammation. When we have that sympathetic response, this activates a number of inflammatory responses, namely NF-kappa B in white blood cells. So now we get interleukin-6, we get tumor necrosis factor alpha, and we know that the immune system does regulate sleep. And if we don't feel well, sleep is one of the first things that gets impacted. Similarly, if we're not sleeping well, we tend to be more vulnerable to the effects of infection and immune dysregulation. So what happens if you're not sleeping adequately and you're not taking advantage of that 7 to 9 hour window of time of not being stressed and having that restoration? It's going to be setting the stage for inflammation. It'll make you more tired, you're more fatigued, and now do you think that you feel like having any engagement in physical activity? Usually not. And setting the stage further for obesity, we now see that inactivity comes into this picture. So when we're not active, we get in our ruts, we get in our grooves, we are not burning energy, we start to see greater fat accumulation. And this leads to an infiltration of things like cytokines into the adipose tissue as well. So macrophages go up, mast cells, neutrophils, T and B cells. We start to see a dysregulation or an imbalance. And even the macrophages, the garbage collectors, as I like to call them, they start to shift, going into more of a pro-inflammatory format. So you can see that this is essentially creating the perfect storm. So you've got poor diet, you've got lack of sleep, lack of physical activity, all of which amount to vulnerable immunity. That's what we're talking about today. It's broken immunity, how all of these things start to create a path. And with a more vulnerable immune system, we have reduced antibody responses, we have an enhanced infection susceptibility, and more visceral fat that is inflamed. And so that's going to throw off our ability to fight infection. It's all very interrelated. So I do think that we need to be tending to glucose and insulin balance. We need to be tending to the cortisol response. All of these many different pathways tie into whether or not we have a robust immune system or whether we have a broken, vulnerable immune system that sets the stage further for changes in body composition. For many people, this can be a catalyst for change. You start seeing changes in blood markers like blood glucose or fasting insulin, or simply the change in one's body where weight starts to stay on and doesn't come off. So obesity can truly be viewed as a side effect and a signal of a long-standing microbiome and immune relationship divide. You can see again how when we hit on all of these cylinders, we start to see the snowball effect. And this is why you can't just cut calories and be done with it. So I do think we have to be looking at the mechanisms. We need to be looking at the root cause. We need to be healing leaky gut. We need to be reducing inflammation. So how do we do that? Well, one of my first ways to think about this is to be bringing in food first, of course, right? Because food provides so much information, and if we're not dealing with all of that information, that deluge that's coming in and being digested and absorbed and assimilated within 24 to 48 hours, then we're missing an opportunity, right? Because if we're not properly digesting that food, bringing it in, it becomes antigenic. So we need to have foods that cultivate a good, healthy microbiome. One of the first things I think of here is phytonutrients. Of course, mostly in nutrition, we think about the macronutrients, we think about the micronutrients. We don't often think about phytonutrients, but one of the things that we're now seeing in the gastrointestinal literature is that we've got probiotics, prebiotics, and polyphenols as a separate category. These polyphenols, like from blueberries, are worked on by the gut milieu, by the different microorganisms, creating these secondary metabolites. So essentially what we get are reduction in pathogens, they're anti-inflammatory, they're high in antioxidants, so they help to reduce oxidative stress, and they can help with lipid and glucose metabolism. So definitely we need to honor food first and foremost because of the sheer mass, the sheer quantity of matter that comes in to change the gut. The other thing we need to be looking at is exercise and sleep. So we know that exercise increases inflammatory and anti-inflammatory cytokines. We need to be sure that the exercise that we're doing is prime for our bodies. We know that it's kind of like the Goldilocks principle. You need just the right amount for you. So having a little bit of intermittent activity can be helpful for reducing inflammation, but if we go overboard, it can actually create oxidative stress. And when we reduce inflammation through proper activity, it helps to improve sleep. And so you see how everything is all tied together. Not only do we have a body web, we have a lifestyle web, and these two webs do lots of crosstalk and interaction. The other thing we need to be thinking about would be all of the different actives that we could be bringing in. So I tend to think of the 5R program, as it's called, really looking at how we can remove things in the gut that shouldn't be there. So I think of berberine. Berberine is a very potent antimicrobial. It gets a lot of discussion these days in the field of dietary supplements. It helps with microbial diversity. It helps significantly with lipid and glucose metabolism. There are a number of studies on that. And thyme and oregano. In fact, what you're seeing in that picture, I believe, is thyme. I have thyme growing in my garden, and I know that it's one of those plants that is so hardy. It grows throughout the year. It's pungent, it's strong, and oregano as well. You know, these two are a powerhouse in terms of wiping out the bacteria, the microorganisms that should not be in the gut and cause dysmetabolism. One of the passions I have is that of fiber, fueling the microbiome, starting there. And if you are eating a more phytonutrient-rich diet, naturally you'll be getting more fiber. So looking at fiber as an underappreciated workhorse, I tend to think of fiber as, it's been so ho-hum. People seem to have their eyes glaze over when you mention fiber, but you know what? Fiber is incredibly therapeutic. And I think that there's a very sophisticated science to fiber that we need to recognize. So as you can see here in this particular study looking at short-chain fatty acid production, and that's one of the benefits of fiber, that we get more with a high fiber diet. These short-chain fatty acids, as I mentioned before, they help improve the gut barrier. They help with mucus layer recovery. They help to grow certain microorganisms that are beneficial, and they help with lipid and glucose regulation. And all of these effects translate into what? A healthier immune system and healthier body composition. Another thing that fiber does is it helps to restore tight junctions. That's what we want. We want better integrity in the gut. And so things like glutamine help to reduce gut permeability by restoring those tight junctions. And the short-chain fatty acids from the dietary fibers will help with enhancing epithelial turnover. And probiotics, again, we need to be thinking of probiotics, prebiotic fibers, and polyphenols. And that's a short list because now we know that in the gut world, there are all these different biotics, whether it's parabiotics, postbiotics. But for the purpose of our conversation, we can make a lot of headway just by talking about the pre and the probiotics. So let's talk about the human milk oligosaccharide. I mentioned very early on that these HMOs are found in breast milk, and they help to reduce microbial infections because of how they work mechanically in the gut. So one of the things that they do, as I mentioned briefly, is that they're a pathogen decoy receptor. So they act as a potential site for the pathogen to bind rather than, again, make its way into the enterocyte and be taken up. So it's kind of like a shield. They are also prebiotics. So any kind of oligosaccharides, anytime you see that designation, be thinking of prebiotic. And because of these two effects, they're going to help to modulate the immune system, of course. Another active that can help with glucose control, and there are so many things that you can be doing here, so you got to figure out what are some actives that give you the most effect for the amount. And so with this in particular, a hydrothermally modified starch and pea protein, we know that protein and starch together, putting these two very specific types together helps with overnight hypoglycemia, better postprandial glucose compared with oatmeal, and better satiety. And you can see that having this starch and pea protein helps with overall glucose levels, right? And so I think that this is important because why do we have to be thinking about glucose and what spikes glucose? Because that is parallel with insulin release. Insulin is an anabolic hormone, stimulates growth. It can, all of this whole cascade can lead to inflammation, can lead to dysmetabolism, and if there's more inflammation, that means immune issues as well. Thinking of some of the next-gen microbes, of course, I mentioned probiotics. The way I think of probiotics is more of a therapeutic intervention. It's not I tend to think of the prebiotic fibers as laying the groundwork, getting the terrain set, creating a healthy milieu, establishing pH, getting a lot of these secondary metabolites in order to change the balance. And then when we recolonize, we'll have a better milieu for which to have these different microorganisms, these different probiotics to come in and to start to adhere. I think that, in the way of how I think of healing the gut, it's much more about establishing the terrain and then moving forward with having the probiotics come in. I think that there are different ways to do this, of course. But with bifidobacteria lactis for 20, you can get a number of great effects. And in fact, there are microbiome tests where you can look at bifido versus lactobacillus populations. Many people are very low in bifidobacteria. And bifidobacteria is important because it increases the levels of other types of microorganisms like Akkermansia muciniphila. So I just happen to be one of those people that has a high Akkermansia level. I think it's because I eat so many plants. But you can prime your gut by having probiotics and different prebiotics to enable the growth of some of these really healthy gut microorganisms, because Akkermansia by itself, it's just not very stable to be taken as a probiotic. Bifidobacteria strains, and in particular this one, well, or actually the genus is Bifidobacteria. The strain we're looking at, the species and strain is Lactis 420. We see a decrease in fat mass, a decrease in permeability, inflammation, and reduced energy intake. Overall, it sets the stage for a healthier gut milieu. And you can see this with just even looking at body fat on this graph here, where you can see the placebo with the bluish bar, and with the orange bar with the probiotic, you can see how body fat comes down over time. Whereas with the placebo, it goes up over time, is more the indication, right? So you keep at least things stable. And so if you're thinking of different microorganisms, how do you reestablish and repopulate the gut? What are some of the probiotic strains to know? I do think that complexity, we don't want monoculture in the gut. We want complexity, we want diversity. Having small amounts of many different microorganisms is truly, from what I can see, it's the way to go. And therapeutically, for certain symptoms, we can start to bring in certain probiotics to help with restoration of gut function. So here is a list of some of the ones that are beneficial in terms of helping with immune activity, protecting the epithelial barrier, and overall helping with, you know, if you're monitoring immune activity, you're going to start to bring down inflammation, you're going to have less leaky gut, you're going to have just overall, this will translate into, through that ripple effect, better body composition. So in closing here, there are a lot of things that I talked about, right? Just to give you us the high level, I went through the gut anatomy somewhat. I talked about some of the things that chisel away at that well-established gut immunity that is typically secured very early in life, and we start to chisel away at that with medications, with diet, with inactivity, with poor sleep. So what do? Again, the solutions would be to remove whatever is offending the gut, whether it's causing bloating, distension, gas, any kind of constipation, irregularities in motility. We need to get rid of those microorganisms. And I talked about thyme, I talked about oregano, berberine for that particular reason. If we think of then feeding the beneficial microbes in the gut barrier and really repairing, and those epithelial cells are responsible for the, again, they're turning over every week, about every week. And so we want to feed the gut barrier with the actives that would be health promoting for those different cells, things like glutamine. And if we're reducing inflammation overall, that's going to help with the rebuilding of the gut. So thinking wisely about just a very simple approach of getting rid of those offenders, starting to reduce inflammation, rebuilding the gut, and bringing in a lot of these prebiotic fibers, targeting with certain probiotics depending on symptoms. And then, of course, not forgetting about food, not forgetting about circadian rhythm, stress, sleep, all of the different things that we talked about there. So I feel like even though we have just focused on a microcosm here of looking at the immune system, gut, and obesity, what I think that hopefully you can walk away with is the macrocosm of how life cycle, just through the life from infancy into adulthood, how we can see changes, and also how life style can really create some significant, even short-term effects. You know, this is not something, just within 7 to 21 days, you can see some really substantial improvements in gut function and consequently changes in immune status and even changes in body composition. So I want to thank all of you for being with me today and listening to the presentation.
Okay, thank you guys for all bearing with the little bit of the technical difficulties at the beginning. I want to thank Dr. Minich for a great presentation, ton of information. We do have another presenter as well. Dr. Melissa Blake will be coming up, but just wanted to send and give a little reminder that this is all being recorded, so everyone will get a access to the recording after this event. And if you have any questions, to add them into your questions section on the dashboard, where you can answer them kind of as we go. If we have some time, we might do a live Q&A at the end as well. But with that being said, our next, as I mentioned, our next presenter is Dr. Melissa Blake, and she is the manager of curriculum development at Metagenics. She completed her pre-medical studies at Dalhousie University in Halifax, Nova Scotia, and obtained her naturopathic medical training from the Canadian College of Naturopathic Medicine. Dr. Blake has over 10 years of clinical experience specializing in the integrative and functional management of chronic health issues, with a special interest in neurology and integrative cancer care. So with that being said, I'm going to get this set up. Bear with me. Let's see if we can get this one going properly. And I will see you after this for hopefully, if we have some time, a couple questions and answers. If not, I'll do a little sign off. Okay, thank you.
Hi, everyone. I'm happy to be here as a follow-up to Dr. Minich's presentation to discuss strategies and a roadmap that we can leverage to optimize the relationship between the gut microbiome and the immune system, and how optimizing that relationship can support weight management. So we've just heard in detail about this amazing relationship between the gut microbiome and the immune system and how they really evolve together. And I love this idea of thinking about them as being friends since birth. And because of that long-term relationship, we know a lot about what brought them together and why they became great friends in the first place. And we can really leverage that information to supply relationship building factors and minimize relationship damaging factors within our roadmap. So we're keeping it really simple. We're adding these layers to our program that really helps us explain how and why we're taking each step to our patients, because we know that when the roadmap is logical and easy to understand and follow, it's really going to help patient adherence and lead to better outcomes. So we've created this roadmap to restore this immune microbiome relationship in 4 different layers. And how many of these steps that are going to be part of the protocol will really depend on what the patient is willing and able to do. So when we're explaining any protocol, we can use this kind of roadmap to help patients better understand the ideal kind of big picture treatment plan. You know, it's comprehensive and it covers all 4 of these areas or rings, but ultimately it's the patient that determines what's feasible. So we're going to start at the core. That's going to be step 1, and then we're going to add layers in whatever way works for the patient, depending on their level of motivation, you know, the severity of their symptoms, and also their budget. So we can really personalize and customize this based on the individual in front of us, not just on their clinical picture, but also on what they're able to do at the time. So step 1 in this roadmap is to choose an appropriate medical food. And I absolutely love using medical foods within any protocol. There's so many advantages. The first thing is it gets patients into the habit of incorporating a nutritional shake into their daily routine. So we know we're really covering our basis when it comes to incorporating a nutrient-dense shake or powder into their eating plan and providing that high quality nutrition and a balanced macro and micronutrient intake. And then we get to kind of play around based on what is at the core of this patient's problem, what is really running deep and adding the most fuel to the fire. So when it comes to the immune system and the microbiome and that relationship, two medical foods kind of rise to the top. And the first is one called Ultra GI Replenish that is really going to address more of a compromised gut function. So serious dysbiosis, immune dysregulation, a lot of GI symptoms that maybe are interfering with the patient's day-to-day and quality of life. And this particular product is providing 2FL, which we spoke about in the science portion. It's a unique prebiotic. It selectively nourishes beneficial bacteria and also acts as a decoy receptor. So it's really promoting intestinal microbial balance and also preventing any kind of overgrowth. If you find that the patient is dealing more with a glucose concern, we know that this is a pro-inflammatory state and it increases the risk of multiple comorbidities, then ultra glucose control would be a great choice. It provides a slow release resistant starch and prebiotic fibers. So you get both a microbiome benefit as well as a healthier insulin response. And that obviously contributes to glucose regulation and improves satiety and can really help to curb carb cravings and reduce hypoglycemic incidence. So this would be a great choice for those patients that really feel like they're riding that roller coaster and have a hard time modulating their appetite. And then, of course, just in general, in terms of a weight management program, these are fairly low calorie and they can be incorporated as not just medical foods, but as meal replacements as well. So they can contribute to a calorie control eating plan. And step 2 in our roadmap is to supply dietary fiber. And this truly is an underrated step. And we know fiber, when I look at the difference between a refined, ultra-processed diet and one that's higher in plant and whole foods, fiber really does show up as one of the biggest differentiators. And we know fiber feeds the gut microbiome. It promotes higher levels of short-chain fatty acid production. It supports regularity, which is an important aspect of our metabolic detoxification pathways. And it's one of the friends that just keeps on giving, because we also see better satiety, glucose control, lipid support. So it really is something that we want to incorporate as part of this relationship restoration plan. Herb bulk is a little bit more of a potent fiber. It's higher in soluble fiber, so that fiber helps to really hold water. So we might, with many fibers, we might want to titrate up, especially if the history suggests that fiber might be a challenge. So herb bulk is a great solution for loose stool. It supports glucose regulation and, again, promotes satiety as well. Metafiber is a little bit more gentle. It's great for people who have a more sensitive digestive tract. Some people who found maybe that herb bulk produces too much gas could easily transition to metafiber. It's 6 grams of insoluble fiber and is flavorless, although both of them can easily be added to a medical food or a nutritional shake. So it makes it just kind of this 1-2 step that's simple and easy. And as I mentioned, fiber also increases satiety, so a great addition to any weight management and body composition plan. And then step 3 in our relationship restoration roadmap is to reinoculate. And the idea here is to supply the probiotic that is going to address the concern that is most important for the patient. So asking questions like, what bothers you more? Is it GI symptoms? Is it appetite control? Is it your immune health? And that will really help you discern which product is the best choice for that patient. So if GI symptoms are a key focus and a concern for the patient, then Ultraflora Biome Pro would be a good choice. It's an 8-strain product that provides 105 billion CFU per dose, while the Ultraflora Control would be a good option for someone who's really wanting to take a weight regulation focus. And it's a single strain, so it's providing that bifidolactide B420 that we talked about in the science portion that has some clinical trials to support weight regulation. And just to keep in mind that with all of these strains, we're getting very specific benefits, and the science is really diving into what benefits are tied to specific strains, but we're also getting next generation microbes that are being promoted by these probiotic supplements. So it's really a win-win when it comes to supplementing with probiotics. So then after those key strategies are in place, then we can really have fun customizing with based on specific needs. So we can increase the leverage by really addressing what it is that's bothering the patient the most, right? So are they a cardiometabolic patient and they need some lipid and insulin support? Berberine GT would be a great option for that. Is there more of an overgrowth picture and we want to continue this GI impact and support? We have Candibactin AR, which is concentrated essential oils for more of an upper GI picture, and then we have a multi-herbal berberine blend, Candibactin BR, that would be great if the lower GI is more symptomatic. But the thing is here is that you can really personalize this in any way that meets the patient's needs. So if you wanted to target more blood sugar in a more assertive way, then there's Wellness Essentials Healthy Balance that will provide that extra blood sugar support. Or maybe it's sleep or stress. So we can really tailor the plan and make it highly customizable by just changing the add-ons and making it very personalized for that individual patient. And really the big takeaway is that we can, as clinicians, put together the most fantastic protocols, but they need to be actionable and relevant to the patient. So an important question to ask is, what is the patient willing and able to do? And to really help the patient determine what are the small and achievable goals that we can outline, that we can celebrate, that we can set clear expectations around. So when we're putting together this treatment plan, we want to talk about cost, we want to talk about duration, we want to talk about what do we expect to see change and when, and we want to also offer troubleshooting. So if a patient does have a question or things aren't going as planned, who do they reach out to and how? And the more that we can outline that and make it really clear for patients, the more energy and brain power they can spend on their treatment plan. And the literature suggests that cost is definitely a factor that we want to consider when it comes to adherence. So pricing is important. We need to be upfront about it and really discuss cost and provide options. And I love outlining the per month and the per day cost because it really helps to break it down and helps patients realize what I can remove to make room for this health promoting protocol. So really break it down for patients, have these conversations, and then let them know that there are different stages, right? We don't have to do everything all at once if it's not an option for you. We really can personalize this, and you're going to get benefits no matter how many layers you do at one time. And we also always want to put the patients at the center. We want to acknowledge that making change is challenging. And especially when it comes to weight management, weight might not be your patient's main concern. It might be yours, but it might not be your patient's. It might not be what's impacting their immediate quality of life. So maybe it's headaches or sleep or pain. And it doesn't mean that we have to completely change our protocol, but it does mean that we have to tie our programs and our recommendations back to the patient's why and bring their view and their goals front and center. We want to acknowledge that it can be challenging. We want to acknowledge that every step counts, but we always want to bring their why front and center, because that is really what's going to help them maintain some level of motivation. And to wrap up, I just want to highlight some of the amazing services and resources that are available to you through Metagenics. And you can reach out to your local rep who can direct you in the right direction in terms of product and patient guides, protocols, science reviews. We also have an amazing first-line therapy program, so if you're interested in knowing more about that, you can schedule a teleconference with a first-line therapy practice specialist. And we have this fantastic resource. Our medical information team is made up of 4 clinicians that are available to you almost 24/7 for any patient questions. If you have a product question or if you want support in addressing a specific concern or building a protocol, this amazing team is available to you just with a simple phone call. Another aspect of adherence is education, and this can be extremely time-consuming to create educational resources for your patients. So we've taken that initiative and have created patient-facing content. So our clinicians have worked on this content, and it's available on Metagenics Institute. So these are resources that you can download and print or email to patients that really help to explain complicated lifestyle topics and really saves a lot of time, and they're beautifully designed and really well referenced. So I'd highly recommend checking those out. Thank you so much for your time and attention today.
Okay, thank you, everyone. That gets us right to the hour, actually. So we're going to be conscious of everyone's time. And I know there were some questions that were asked, but we did have Dr. Blake on the back end answering some questions. So if you do have any other questions, though, feel free to email webinars@fullscript.com, and I can pass them along or see if I can provide the answers for you as well. As a final reminder, you will be getting access to this recording along with any additional resources we can provide. I know Fullscript also has a few protocols that we will try to include as well in the follow-up. So keep an eye on your inbox for that. And a big thank you to Metagenics, to Dr. Minich and Dr. Blake for their presentations today, and for all of you for joining us. And we hope to see you again next time. Enjoy the rest of your day. Thank you.